Hello, and welcome back to another episode of More Than Milestones. I am incredibly excited to be here today with Dr. Felice Chan, who is a doctor of acupuncture and Chinese herbal medicine and the founder of Felice Acupuncture and Moonbow. We are going to be talking all things ancient wisdom, modern motherhood, integrating traditional Chinese medicine into everyday parenting and womanhood. But I am truly so excited. So thank you so much for being here, and tell us a little bit about you before we start.
Of course. Thank you for having me. I feel so grateful. I'm Dr. Felice Chan. I spend most of my life, honestly, 24/7 practicing traditional Chinese medicine, whether it's my daily life, in my clinic seeing patients, but also through my entrepreneurship. And my whole goal is to spread Chinese medicine wisdom because it's something that has transformed my life. I see it transforming people's lives every day. And to see that integrated in the Western world brings me a lot of joy.
Yeah, it's incredible. And I'm so thankful that I found your page. And we'll get into this a little bit more later, but I was sharing before we started recording, I had mentioned that when my kids were young and teething, I had used some herbal medicine and some traditional Chinese medicine tinctures and stuff like that. And it was incredible, but we'll talk a little bit more about that in a little bit. But thank you for being here, and let's get right into it. Okay, so I know, well, at least for me, I think a lot of moms feel pulled between like wanting a holistic approach and living in basically our modern world, our fast paced, we want instant results, you know? And I'd love to explore on this episode how ancient systems like traditional Chinese medicine can support modern motherhood and not add pressure. But I feel like where we can maybe start is just, can you tell us a little bit about what drew you to Chinese medicine and acupuncture?
It's interesting because I grew up in Hong Kong. I was born and bred there. Chinese medicine was very much integrated into my life, from the herbs I was given by my parents and my grandmother, to the food I ate, to seeing herbal stores all over Hong Kong, to acupuncture. It was very much part of my lifestyle. But it's interesting, as an Asian woman and the expectations in an Asian family, I actually pursued Western medicine. So
Ah,
I grew up in an international school in Hong Kong. I came to the US for college and I studied neuroscience. I actually spent a lot of my summers as a child actually watching a lot of surgery. So I shadowed a neurosurgeon for many years. And so that led me to studying neuroscience in college. And then
very cool.
ventured off to the Western side for a bit, worked in a hospital in clinical research, applied for the MCAT. And part of me was a little bit frustrated with the system and it didn't sit with my values. And so I decided to take a 180. I just kind of dropped everything I knew and was studying for years. And I moved out to LA and came to LA for traditional Chinese medicine school.
Wow,
And that
that's
was
amazing. Oh my
that's the end
gosh.
of my life.
Wow. So do you feel like you integrate both, or do you feel like you really lean more towards traditional Chinese medicine?
In my practice, I definitely lean more towards traditional Chinese medicine, but my Western background has given me a lot of more clarity of how to help a lot of people because most of the time people find Chinese medicine as a last resort, right? Because things aren't
Yeah.
working. And so to work integratively, because in reality, everyone's going to be on some type of medication or has seen some type of Western doctor. So to understand how that works and how that integrates with a Chinese medicine system of medicine is really important.
Yeah, absolutely. Oh my gosh. So how do you feel that your understanding of, I know you really talk a lot about women's health, and I have learned so much from your page about even just things like what to eat and drink when you have certain types of presentations of symptoms, that I'm like, how is this not something that we all know? Like that is, it's truly incredible. And so how do you feel like your understanding of women's health and motherhood have evolved through traditional Chinese medicine?
Oh, I love this question. I think traditional Chinese medicine has given me a perspective of more holistic health, but also tuning into what your body really feels like and what it needs. I think a really good example is that we're human beings, but we're also nature beings. And just like nature, we respond to hot and cold and dryness and environmental factors. And so when we apply it to ourselves, it makes so much sense. And essentially, Chinese medicine wants to bring you back into balance, right? When you're a little bit deficient, when you're dry, when you're cold, you're a little bit lower, right? The opposite is if you're hot, if you're aggravated, that's the opposite of the scale. So traditional Chinese medicine just basically shares how to bring you back into balance where you can heal and where your nervous
Mm,
system is reset. And from this equilibrium state, you start to heal on your own.
wow.
Mhm.
Wow. That's incredible. Was there a moment for you when you realized that Western medicine wasn't always answering the deeper, like, why behind specifically women's symptoms?
I think the biggest revelation I had was when I was working in a hospital post college. I was working in the allergy and immunology department. I was working with a lot of kids and pediatrics with eczema. And I was doing research studies where they were getting injections and also a lot of steroid use. And it still didn't get to the root of their issues, right? Eczema still kept popping up. Some got better. And if and when they did, they had a lot of side effects. And
Mm.
so I remember talking to a lot of patients, and I was at Boston Children's Hospital at this point, and they had actually acupuncture integrated within the hospital system. And one of my kids that I worked with for a while, he was like, acupuncture is the only relief I get where I'm not itchy. And he's
Wow.
someone that never stepped into the ocean. He's someone that was really impacted with his, childhood. He couldn't do what most children could do. And so that was a revelation where I'm like, okay, this is a sign for me to get back to my roots and study Chinese medicine. And I was already in a phase where I was seeing this every day. I was feeling frustrated. Chinese medicine was part of my lifestyle. And so I decided to just shift.
Wow.
Mm.
Wow. That's amazing. And I think that's such a big piece of also kind of where I found it, obviously on a much lower level, but it was like I specifically teething, I was like, I didn't want to keep giving Motrin and Tylenol and all of these things. And I was like, there has to be a better way. And what a difference. But before we get into that, when you when you think about modern motherhood today, what do you see moms struggling with most from a traditional Chinese medicine perspective?
Yeah, we can almost split it into different subsets, right? I think what I see the most and you can shift me in whatever way, right? There's the fertility aspect of it where a lot of moms are trying to get pregnant for the first time or again, and they struggle with it. And I see a lot of patients because somehow their body's imbalanced. I see a lot of postpartum, right? Because postpartum issues are very common, and
Hmm.
Chinese medicine has a complete different understanding of it, and it's very effective. I can dive into that a little bit. For example, when you give
Yeah.
birth, a lot of your energy, what we say our qi, which circulates our body, it's depleted. You're using all of this energy to literally push a baby out, and all of your energy for the past, 9 months of pregnancy is focused on growing this baby inside of you. And also when you give birth, a lot of blood is lost, right? It's almost like when we get periods every month and when you're giving birth, it's all of this blood that is lost. And so how do we replenish that? And from a traditional Chinese medicine standpoint, a lot of what happens postpartum, whether it's mood, whether it's dryness, even lactation issues, anything that anyone comes with is always tied to that period of birth and how it was and how much you lost. So you have
Mm.
to replenish it. We have to boost our chi, which is our energy. We have to replenish our blood. And in that essence, it makes us so much stronger. And a lot of the ailments that we feel postpartum start to dissipate.
Wow. And now, I mean, obviously it would be specific to each person, but how do you do that? Because like my first thought is like replenish my energy, which obviously I know is not what you're saying, but like when I think of replenishing my energy with my newborn there, it feels a little bit daunting. Like,
Of
is
course.
there simple, tangible things that women or moms postpartum can do to support that?
Absolutely. One of the things is rest, right? It's interesting. In Chinese culture, after you give birth, you are on bed rest for a month. And in China and in Hong Kong, you have a postpartum nanny or your grandmother will cook for you every day. You're in bed, you're resting, you're actually taking time for your body to feel strong again. And a
Wow.
lot of the foods that are given to you are blood nourishing foods and what we say yin nourishing. Yin nourishing is basically our cooling system and what gives us our vitality and longevity as women. And so a lot of the foods are very high in, B vitamins and iron. So a lot of grass-fed beef, meat. We also have a lot of lamb because it's very warming. And if you're
Mm.
vegetarian, there's also so many other vegetable or plant-based options like goji berries and jujube dates because in nature, all of these foods boost your blood and boost your chi, which is your energy. And so over time with certain amount of meals and foods that you eat can also help with a lot of postpartum issues that we experience.
Wow, that's incredible. And a month of bed rest sounds amazing. How is there resources? Do you have specific like a guide for postpartum women to say like these are really excellent foods to eat. These are really excellent things to build back into your diet to replenish.
Yeah.
Is there resources that we can link for people?
Yeah, I'll send you a resource, but there's a book about, 40 days postpartum and Chinese medicine meals that is awesome. I'll send that to you.
Okay.
I can share a few ideas and recipes now. It's interesting whenever I talk to my mom about it, and she's in Hong Kong, and she's like, whenever, you give birth, I'm gonna come and cook for you.
Oh
And
my
one
God.
of them is a black chicken soup. So you know how there's chicken, and most of the time when they're defeathered, they have a white skin, but there's different types of chickens where the skin is actually black. And in Chinese medicine, it actually nourishes your blood so much more. So it's awesome for postpartum.
Ah,
There's also a tea that I love that has helped patients tremendously. It's a jujube date and goji berry tea. You can, put a handful of goji berries in a small pot of water, cut up 5 to 8 jujube dates. I like to de-pit them, boil it for 15 minutes, and you can drink it throughout the day because it's one of the best blood tonics and chi tonics to help with postpartum.
how oh my gosh, that's amazing. I will link anything and everything that Dr. Felice sends at the end. It'll be in the show notes just for anyone that's listening and like, I want get my hands on that.
I'll make sure.
Yeah. Okay, so I would kind of love at this point to get into traditional Chinese medicine 101, two busy moms and four busy moms. So can you just and you've done this a little bit already, but can you talk to us about how like we're a total newbie, which I'm sure many of us are, and just like the understanding of traditional Chinese medicine and the body being an interconnected system and the balance and all of those things.
Happy to talk about that. I always like to say there's 4 pillars of traditional Chinese medicine. Number one is acupuncture. A lot of people find traditional Chinese medicine through acupuncture, or they hear from a friend that, acupuncture transform X and X ailment. So how acupuncture works is that we use little tiny hair thin needles to activate our chi, which is our energy. And we have energy systems that connect from our feet to our toes to our head. So for example, if you have headaches, we'll put a point on our toe because it brings the energy down. So everything is interconnected through what we call the meridian system. And the
Hmm.
meridian system passes through major organs and parts of the body. And so everything is connected in the body. And it uses the concept of chi, which is energy. And chi, this energy, runs through our body through this meridian system. So when we use the acupuncture points and we hit certain areas, let's say between our hands, on our toes, these are the energy wells where a lot of the energy is gathered essentially. And so when you put a needle in this well, it spreads this energy across our entire body. The second pillar I always like to say is herbal medicine. It's the tinctures you were talking about. It's the herbal medicine that you can get from practitioners or herbal stores. And these herbs are most commonly in formulations, meaning it's a mixture of herbs because our body's holistic and complicated. So we need many different herbs to target different areas and also to work synergistically together. In Chinese medicine, we rarely prescribe just like one herb together. We aren't, we don't say take ginseng every day for energy. And maybe that's a common herb we've all heard because ginseng increases our energy. It's an adaptogenic, but in essence, it's very hot and warm. So if you're someone that has a lot of heat symptoms, you get angry easily, you feel hot inside. It's almost like the Pitta Ayurvedic body type. It's not great for you, right? So you need another herb to cool you down and to balance. And then the third pillar is food as medicine. It's what I described before, eating, chicken soup. It's eating sweet potatoes or black sesame seeds or having cooling greens like bitter melon or dandelion greens if you're feeling too stressed or hot. And so every herb and every food has an energy component to it, meaning it's hot or cold. It doesn't mean the temperature of it, but it's essentially what it does to your body. And every food and herb actually goes to a specific organ in your body. And then the last is lifestyle. We always emphasize the lifestyle about balance. We live in this Western world where a lot of, we say our yang state is encouraged. Our yang state is our go, go, go. We're working all the time. We're doing 100 things at a time. But in reality, our body thrives on balance. It's almost like a nervous system switch, right? So as much as we're in the sympathetic, fight and flight, go, go, go state, we have to find that equal amount of balance. What we say the yin, it's the yin to the yang. The yin is the parasympathetic state, our rest and digest, what brings us joy. And so we always say, how can you find that joy? How can you rest your nervous system? Chinese medicine principles, we love Qigong or Tai Chi, which is energy movement that slows us down. Walking, meditating, journaling, spending time with your kids. Doing things are not on your to-do list. And that's how you truly tune into your body's healing system.
Wow. I just even first of all, for some reason, listening to you talk is like giving me chills. And I don't know why, but it just,
It's just
I
medicine.
feel, yeah, I feel like it's such an incredibly well-rounded approach that completely differs, it feels like,
Yeah.
to Western medicine. Like
Yes.
it's so often putting a Band-Aid on something rather than finding the root cause, especially for women who are postpartum or moms or navigating perimenopause or all these things. And now I want to find a doctor near me. Unless, do you work virtually?
I do work virtually, but I know incredible acupuncturists in New York City. I know a lot. So I'm happy to send you that list as well.
Oh my
So
gosh.
either
Okay.
sits well with you if you want to work virtually or see an acupuncturist in person, because sometimes doing that is so powerful to actually feel that.
Yes.
So whatever you prefer, happy to suggest.
Wow. Well, also, if there's like a website or a list of where you can go and search your area to see if there are providers, we can also add that to the notes. So that's
Yes,
incredible.
absolutely.
Because, well, that leads right into this next part. I feel like a lot of times moms feel, or women in general feel like something is off, but nothing is showing up, or nothing is, their blood work looks okay, or, they're being written off. How does traditional Chinese medicine help to really tap into that? Is it because you're looking at the entire picture and you're looking at really just even kind of that disconnect between understanding our symptoms and our bodies as a whole and what we're going through?
100%. It's so funny. I see that a lot, where mothers come in, they're like, my labs are so normal. Everything's within range, but I feel crappy. There's something going on in my body and I don't know what it is. And a good way to look at it is that Western medicine looks at the body in a compartmentalized way, right? They look at blood tests, they isolate hormones. You have an ENT doctor, you have a cardiologist, you have an orthopedic doctor, right? So everything is separated, whereas Chinese medicine looks at everything as a whole. So let's say you come in with blood labs that are normal and there's something off with how you're feeling. We then ask you a bunch of questions. It's so funny whenever I get a new patient in clinic, I talk to them for like 30 minutes and I'm like, tell me everything about your stools, your sleep, your energy levels. I want to look at your tongue. I want to feel your pulse, because essentially it's putting puzzle pieces together and all these symptoms they feel. And I'm able to gather a root cause. There's something underlying that is causing everything they're feeling.
Mhm.
For example, if someone's feeling bloated, brain fog, fatigue, they're having edema or swelling in their legs, it's all because we say a spleen qi deficiency or some type of imbalance in the organ system or the meridian system, that once we target it and we work on, a lot of these cascading symptoms start to dissipate on its own. And so
Wow.
that's how we help from a Chinese medicine standpoint.
That's incredible. Uh, okay, I feel like this is the perfect time to maybe demystify herbal medicine and address, like, what are some of the common concerns that you hear from people about medicine and the medicine that you're practicing and implementing
Yes,
in herbal
absolutely.
medicine and that?
Yes. I think the very first thing is, people have trouble trusting Chinese medicine because they don't understand the education that goes behind it. For example, I got licensed here in California, but I went to med school, it's actually a master's program for 4 years, which is half lecture, half clinical rotations. It's very similar to Western medicine, but instead of being placed in fellowship or residency, you have to go out on your own. You start your own business or you work for someone, right? And so you have the toolbox. And I actually extended it for another year to get my doctorate. And that doctorate was focused on integrating Western and Eastern. And so a
Mhm.
lot of education goes behind being a Chinese medicine doctor. And I think people's understanding of that is it helps them demystify, oh, okay, these people are educated, because a lot of the times it's a trend or people hear it from someone else and they have no idea what goes into it. So that's the number one thing. The second thing is, people are like, oh, I believe in acupuncture, acupuncture works or it doesn't. And in essence, it's not a belief system, right? It's a medicine that's been around for 5,000 of years. And what's incredible is that over the past few decades, science has finally caught up to it. It's almost a system we have to switch, where science is made to be disproven. And so the fact that science is able to prove that acupuncture works through clinical trials, which is very much stringent, even it shows the impact of acupuncture because it is individualized, or Chinese medicine or herbal medicine. For
Mhm.
example, you'll come in versus mom 2, mom 3 with the same issues, but you get treated so differently because you're your own being an individual.
Mm.
Whereas, clinical research or science will bring all these moms together. They get the same herbs, the same points, and it still works. So if you're able to add a component of individualization and helping them with who they are, it's even more powerful. And so there's that system of whether acupuncture works or not. And then the third thing I want to demystify is acupuncture is painful. It is
Mm.
not. I wish I should have brought a little needle, but they're hair thin. You can fit 30 needles into a hypodermic needle, which is what we use for injections. They're the hollow ones.
Wow.
So they're so thin. Sometimes you feel it's a little pinch, but it dissipates within a few seconds. And some needles you don't even feel. And so I think it's more of a mental fear that people have. They're like, oh my gosh, I hate needles. They're horrible, which I get. It's not normal to want to be poked. But if
Yeah.
you're able to shift your minds to be like, okay, these are baby needles, like if you shift around a little bit, it's fine. You might
Mm.
feel a twinge here and there, but they're so thin, it's not going to damage you.
Yeah, yeah, absolutely. It's interesting that you mentioned the research piece, and I love to hear that it's catching up. But I think one of the biggest difficulties that we have right now in our world is that we want the research to back up every single decision that we make, and it's simply not possible, and there are so many things where the research is catching up. Even in pediatrics, I feel like
Yep.
people are like, what's the evidence that crawling doesn't matter? And it's like, like all of these pieces that need to come together to like make someone believe that what to be true is backed by research. It's such a fascinating aspect of our society. I feel like. Do you?
Yeah, it's definitely a shift of Western versus Eastern. And it's again the difference between different modes of thinking. It's not to say one is right or one is wrong. I think Western medicine is so important. It's so important for emergency situations. It's so important for understanding the nuances of, certain pathways or pharmaceuticals. But at the same time, there's Chinese medicine, which is so much more intuitive. And so
Mhm.
sometimes I tell a lot of my patients, if they have a question about something, I'm like, does it feel intuitive? Does it sit with you? And we are human beings. We have this energy field around us. It is proven, acupuncture very much ties in with quantum physics. There's so much proof there. And I just encourage people to be like, okay, you have the power to heal. It's all in you. Just tune into how your body feels. And it could be as simple as, does iced coffee make you feel shitty? Or do you need a hot coffee to feel better? Or what if you sub it with just hot water in the morning? Just even the temperature of that. Tune into how you feel. Does your digestion feel off? Do your stools change? Does your energy change? And even those simple shifts, people are like, whoa, this is fascinating because that's a small little tip and people start to feel better.
Wow. It's so interesting that you just said that. Okay, I had seen a post that you had shared about um trying not to drink ice water. And
Mhm.
if it is not freezing cold, if it's not iced coffee, I'm like, and I never really thought about that as like who I am as a
Yeah.
person. Wow. That's so interesting. Oh, okay. So less, I would love to shift to talking a little bit about integrating traditional Chinese medicine with modern medicine and parenting specifically. So can you tell us a little bit about how you view immune development in babies and young children?
Yeah, I love this. And immune development in young babies and children is very similar to adults, right? Where we respond to environments. We are so, human beings are so smart. And we can't forget that, like even let's say a vaginal birth versus a C-section. There's so much information the baby gets when it exits the vaginal canal, right? Compared to when a C-section happens because of all the bacteria, everything that the baby experiences as it's giving birth. That gives a baby so much information about their immune system. And so I always encourage, if you can, stick to what we were supposed to do. If you were to rewind thousands of years and how we gave birth and how we were supposed to take care of our babies and be a mother, it's interesting because, thousands of years ago, it depends what culture, right? Moms gave birth. It was a vaginal canal, birth for the most part, if they could, right? If it was a healthy birth, and they would rest. They would take care of the baby. They would take the time to be a mom. And I think that can contrast a lot from Western and modern modes of just life, right? And modern life, because moms are doing everything all at once. They're not just a mom, they have a job, they're taking care of the household. And so it adds a lot of different layers to it. And so my biggest advice is, if you can, it's just balance. How can you be that mom that slows down, that is intuitive, that trusts the baby, that trusts that the baby's immune system is developing on its own. Um, before you start to dive into medicine and pharmaceuticals. And if you can and you find a good practitioner or doctor, how can you support them with natural herbs or things that they can drink? Because we respond to nature so well.
Wow. Yeah. And I think it's hard to, a lot of times, because we are doing so many things and it's just a go, go, go lifestyle for so many of us, that when it's like that period of their immune development where it's like back to back to back to back sicknesses, and it can just be so hard to not be like, let me
Yeah.
just give them the medicine so that I know they're comfortable, so that I know that they're healing, or healing in my mind. But we can actually, instead of just treating the symptom, we can actually like help support their immune development.
Mhm.
No?
Yes. Oh, absolutely. I mean, babies, I would say, and children, they're so receptive to energies and herbs. And whenever we give them medicine per se, it's at a smaller dose, right? It's the same thing as pharmaceuticals and medicine. If you were to give a baby, half or a quarter of a dose, it's the same thing with herbs. And it's so magical and so powerful. And a lot of herbs, for the most part, don't have side effects if you go to the right practitioner and they know how to combine and mix the herbs together.
Mhm. Amazing. Oh my gosh. Can you please explain hot versus cold illnesses? This is the perfect spot. And it's so fascinating to me. And I just would love to hear you explain it.
Of course. I can start with the very simple cold, right? Everyone experiences a cold or a flu, and sometimes it starts in different ways, where someone will have a cold and it starts as a sore throat, or someone has a cold and it starts as an itchy throat and kind of nasal congestion. That already signifies your body is in two different states. A sore throat means there's inflammation, meaning there's heat in your body. Like you physically start to feel hot. And a lot of the times it could be paired with a fever or a cough, but you have to tune into what aspects show hot and heat. And in that case, if you have hot in your body, the sore throat, the fever, the cough, however it manifests, or red face, sometimes people hive up. Those are all signs of inflammation and heat. You have to diminish heat by using cold herbs or cold therapy. For example, a cold herb is peppermint tea, which is great for sore throats. You wouldn't actually treat a sore throat with something hot like ginger, because ginger is spicy. It will make it hot in the long run. Versus cold. Like, let's say you have the sniffles, you have the chills, you want to be covered all the time. You need something warming your body to like push it out. Ginger is a good example. Scallions, these are all food as medicine ways to heal the body. And so sometimes, depending on whenever I get sick and I tune into where my body's at, this is how I heal my body.
Wow. Wow. This is so fascinating to me. I know I just keep saying wow over and over, but this like
Mhm.
absolutely blows my mind. And I love not having to let go of the either, really lean into the either. It doesn't have to be one or the other, put it that way. It doesn't
Exactly.
have to be either this or that. What are some practical tips, like small shifts that someone who's really interested in kind of bringing this into their life can make, versus feeling like you have to totally overhaul and, like change your entire lifestyle? Are there small everyday practices that families can use to support both the child and the rest of the family?
Yeah, absolutely. It's interesting because I think a lot of people can feel overwhelmed by Chinese medicine because it's so dense. I mean, even as a practitioner, I'm learning every day. It's medicine, again, that's 5,000 years old. And so there's so much out there. And so again, it's just taking small habits. It can be, let's say you find a blog somewhere, find information, and there's 5 to 10 things that you're like, ooh, this feels like I want to do it. It doesn't make sense for someone to adopt all those 5 or 10 things in one day. Human behavior is completely the opposite of that. We need to start to build systems, but habits one by one. So my advice is, and I share this with a lot of patients and mothers, that if there's one thing that you want to shift, for example, if prioritizing rest or quality time with your baby is what you want, carve that out. Put it in your calendar, 30 minutes, 1 hour, whatever it is, and start to do that every single day with consistency. And once that becomes easy to do and part of your lifestyle, then you can add something else. For example, drinking the hot water to support you, drinking or, feeding your baby more room temp liquids because they are
Mm.
warm in nature and you need to protect their warmth. Little things like that. You can start from, 1 step to 2 and just keep building until it's part of your lifestyle. And you don't
Yeah.
have to do it all, like even one shift can transform someone's life. It can
Yeah.
transform the baby's health and their health as well.
Wow, I love that. One other thing that I would really love for us to talk about is emotions and parenting and traditional Chinese medicine's view of emotions, because obviously the emotional connection between a mother and a child, or a parent and a child, especially when a child is, say, highly reactive or highly sensitive, what is happening and what's important to understand when you are in a place where you're constantly co-regulating another person's emotions while trying to kind of manage your own as well.
Mhm. I love this question because it's so important to really tune into who you are. And in Chinese medicine, emotions are truly the base and start of all ailments, right? Every organ has an emotion that it holds. For example, the heart is joy, the liver is stress, the kidneys is fear, our digestion, or what we say, our spleen is overthinking and worry, our lungs is grief. And so when we're able to tune into how our body feels and what emotion is tied to it, and we're able to recognize it and process it, not necessarily solve it, but just recognizing it, it helps so much with co-regulation and understanding how the baby is feeling as well. For
Wow.
example, lots of moms are all stressed. We all are. And stress, anger, frustration, it all sits in the liver. And not to say there's anything wrong with your liver, but it's the liver organ in Chinese medicine and the liver meridian, which starts in our toes and goes all the way up into our eyes. And so when our liver is a little bit stagnant, for example, we're feeling stressed, everything feels stuck inside, right? You feel like you're about to burst and all of this energy is stuck in our abdomen. It's why we feel our chest tightness, why we have digestion issues, why we can't breathe deep into our belly. And so if you notice that, you're just like, okay, my liver system in Chinese medicine can be moved a little bit. So how can I move it? Breath work, breathing deep into your belly, shaking your hands and feet. Those are good ways to move all of this stuck energy. Because once you're recognizing it, you process it, then you're able to support your baby in a similar way. Because a lot of the times when they're crying, when they're feeling frustrated, it's a similar situation. They're feeling also frustrated. So if you're able to co-regulate together and understand how you deal with that too, you can help your baby. A baby, you can't ask them to, shake their hands and their feet, but you can start to massage their hands and feet because that also helps with movement. So there's a few ways that you can help. You can even tap the center of their chest because that helps dissipate emotions. And so again, it's tuning into what can help you. Like if tapping in the center of your chest makes you feel good and it makes you feel less anxious, your baby is going to respond because babies and children are so much more responsive to energetic movement than adults are.
Wow. It's so interesting because, like, listening to you talk, I'm like, it's amazing that it almost feels like the Western world has, like, taken all of the bits and pieces of traditional Chinese medicine, but not not given, like, the claim, like, where it came from. Because even when I think about, like, scrolling through my social media, it's like everything is like, wait, the way to move your body, to, like, move your lymph and keep things moving and tapping and like your somatic system, and it's everything that you're saying, but like bits and pieces. So it's not that people don't believe it. It's that really maybe we don't understand where it's coming from and how to integrate it in a way that is your entire body and not just these silos of, like, okay, a therapist is going to approach EMDR therapy from this standpoint and your doctor might approach it from this standpoint, but it's really like the whole picture.
Correct. Exactly.
Wow.
And it's just tuning into it. And, I think at the end of the day, everyone has their resources and you just have to be curious, be
Yeah.
curious to other options and modes and try it yourself before skepticism hits in, just open your
Yeah.
mind. Hmm.
Wow. And now, so when it comes to, like, herbal tinctures and using herbs in general, obviously, especially because it can really be medicine, what is there to, considerations for people that are trying to start to bring that into their lives? Or, is there, this is big ones that is not safe for pregnancy or breastfeeding, or if you're on high blood pressure medication, like, it's obviously not something people should try to navigate on their own necessarily, but are there general safety considerations or regulations that people that are starting to delve into this should be aware of?
Yes, my general answer is yes. I mean, at the end of the day, herbs are powerful and herbs will do something to your body. And again, herbs are natural. And so a lot of it is dose dependent. So, for example, if I'm making a goji berry and jujube date tea, they are Chinese medicine herbs in general. But if you're making a tea and you drink it every day, and if you need it and it helps you feel better, it's probably good for you. But for
Mm.
example, goji berries and jujube dates are warm and hot in nature. So, for someone who is hot inside, who feels like they want to burst and crawl out of their skin, a goji berry and jujube date tea is likely not the best for them to drink every day. So again, it's about intuition and understanding what herbs do what for your body. You
Yeah.
know, another example is chrysanthemum tea. It's a nice, beautiful yellow flower that you can get a lot when you drink dim sum. It's cooling and detoxifying for the body. Also amazing for the skin, which I'd love to dive into later as well, for like eyesight and dermatitis. Anyways, besides the point, because it's very cold in nature, it's awesome to help with stress because stress can mitigate heat, for example, and inflammation. It's awesome for if you are feeling like you have inflammation inside your body to drink as a tea. But because it's cold, it's not the best for someone who has a cold digestion. And a cold digestion is someone who bloats easily, who has loose stools, who's drinking smoothies all the time, because then you're putting cold on cold. I guess that was a 2 example, long-winded answer of, we do have to be aware of what herbs do. So the best way to do it, I would say, is, if you're curious, work with a practitioner. It's the best way to go about it because then you get all your answers answered and your questions answered with them.
Mhm.
Or if you find an herbal store, let's say you venture into Chinatown, a lot of I like to say the uncles working at the Chinatown stores, for example, Kamwo in Chinatown, they're going to have the knowledge to help. But I, again, assume that they're going to be like, if you do actually want more guidance and help, go find a practitioner.
Yeah, yeah, absolutely. And that makes sense because even like the teething tincture that I used had to be ordered by a practitioner. It was not something that I could just like get. Um, yeah, that's very interesting.
Mhm.
Now, let's let's shift for this last part into really like what you wish, whether people leave this episode and are like, wow, I'm super interested in this, like I want to find a practitioner, I want to make an appointment for an acupuncturist or something like that. For people that are listening and like this feels really good to them, what do you wish, or what would you hope that they understand about themselves or the process or finding someone and starting to integrate those things? I know you talk a lot about balance and not doing everything at once, but is there something that you're like, this is something you need to understand before you go on this path?
Yes. The one thing that everyone has to understand is that it takes time. Acupuncture is not a one-stop shop. It's not like going to your doc and getting Advil for a headache, because that, in essence, again, is a Band-Aid solution and it's not getting to the root cause. Acupuncture takes time. For example, when I get a new patient and they're really looking to transform their health, I always preface, I need to see you at least once a week for a good 2 to 3 months because it takes time for your body to shift this homeostasis it's in, right? When someone is sick and they come with ailments, they're feeling off balance, it takes time for your body to naturally shift. And time is what our body needs to heal. And
Mhm.
so you can't rush the process. You have to trust it. A lot of the times I'll have, people come in once or twice, they're like, oh, it's not working. I'm like, of course you're not going to notice it's working. You come in to get a treatment, you're rebalanced, but you go back to your lifestyle, which is stress. You're not sleeping, you're eating horribly. So how can you actually, shift your lifestyle outside of the treatment room to then support your treatment itself?
Mhm.
And so finding a practitioner who's completely holistic, who gives you acupuncture, but also suggests lifestyle advice, movement, stretches, food as medicine.
Yeah.
It's all incredible to really, really
Wow.
support the system.
Yeah. It's interesting because even thinking, I was actually just talking, my oldest, we're seeing like basically an integrative orthodontist who
Mm,
has looked at really what I feel feels like a bigger picture than just like she has a tongue tie, let's clip it kind of thing, or we're just going to put braces on kind of thing. Not that that's what all orthodontists do. That's not what I'm saying. But um, I was talking to him because when he was explaining to me really the importance of laying the foundational things versus just putting braces on, I was like, why isn't this mainstream? Why
mm,
aren't we addressing airway? Why aren't we looking at all these other things? And he was like, honestly, because it takes a lot of work, and putting braces on is kind of just, you put them on and that's the end of it. And
correct.
this feels very similar. Like it's I think we want instant gratification, and we want that, you know, you take the Advil and it works, and you feel better for a little bit, but it really, it's so much more than that. And being patient is just like putting in the work, really, and being patient it's cool that that's like part of this too. It's just kind of tying it all together for me. But
Exactly. I love how you said instant gratification. I mean, I'm there too. We live in a modern world where things need to be quick. Things need to be solved quick. But longevity isn't about that. It's about a lifestyle shift that emphasizes overall health and well-being. And ideally, I would love to see acupuncture as part of someone's wellness routine. In
yeah,
China and Hong Kong, historically, you would get acupuncture to prevent something from happening because in itself, it's a preventative health. It's a preventative medicine. Not to say it doesn't also help when you have issues and ailments. It's so powerful. But if we can almost shift our thinking of how can we live our life to prevent things from happening in the future, right?
I love
Um, yeah, it's just a mindset shift where a lot of people come from a place where I'm only going to see a doctor when I get sick. Well, why
yeah.
don't see a doctor to then not get sick? If you get the seasonal flus, there's ways to strengthen your immune system. There's ways to balance your body out and de-stress your body so you don't get sick ever again.
Yeah, we are so reactive in so many ways. Even like what insurance will cover, right? Like
Yeah.
they're not going to cover a scan per se for cancer, but then they'll cover your treatment when maybe it didn't even have to be that way in the first place. Like that, oof, that's
I
a
think that's a whole nother bucket and again, a whole nother hour of conversation about
yeah,
that
yeah.
healthcare and how
Oh my
healthcare, it shifts everywhere in the world. In Hong Kong, it's, so accessible, so convenient, so much cheaper. But
wow.
again, we're fighting this, institutional essence of what medicine is. And
Yeah,
I have opinions about it. And, for example, in my clinic, I don't take insurance because I have to be able to sustain a clinic to keep helping people. So
yeah.
to a lot of people, it's expensive. Um, so how does that get brought into the medical system more? Should insurance companies be covering it more? But if they cover more acupuncture, less people will get sick. It's almost like a backwards, never ending cycle.
Yep, they make you a forever patient instead of addressing the root cause. That is a
Um,
long conversation. Okay, so let's wrap this up. If you could speak directly to a mom right now who was or is feeling depleted or overwhelmed or disconnected from herself or unsure of how to start integrating some of these things into their family's lifestyle to help their children's health, what would you say?
I would say that you're not alone and that you should just seek out help, right? And the help that you seek out can feel complicated or complex. And let me focus on the Chinese medicine aspect. So most acupuncturists or all acupuncturists who are practicing legally in the United States have gone through an accredited school system, and they're all licensed under two main boards: the National Acupuncture Board, or if you're in California, because California always has its own system, the California Acupuncture Board, right? And so you can go online and actually find a practitioner and find help from them. You can
Mm,
even, go on Google Maps and find an acupuncturist near you, and then you can double check to see if they're approved under, we say NCCAOM, which is a national board, or the California board as well. And I can link and send everything to you. So I think
okay.
that's just number one step. If you're actually curious and taking the time and stepping into this medicine, finding a practitioner near you is the best thing you can do.
I love it. That's amazing. This is probably a silly question. Can is there an age that you cannot receive acupuncture, like that it's not recommended, or literally any age? Any age?
Really any age. I think
Wow.
even for like infants or babies, there's always, I mean, it's interesting where acupuncture and acupressure is where you don't actually use needles, but you massage the baby. A lot of babies are so receptive in children to acupressure. So you're still targeting the energetic system, but they don't necessarily need the needles because it can be a little bit too stimulating because it's powerful. So for a lot of babies and kids that I see in the clinic, I just do acupressure and they respond to it as if they're an adult getting needles.
Amazing. It's interesting. My mom is a certified in infant massage. She's also a physical therapist, and that feels like it must be another one that is like kind of taken from that. Wow, very, very interesting. Oh my gosh. Okay. This was incredible. I feel like I have a bajillion questions and I want to talk about this all, but I have one last question.
Yes.
What is and this is solely for my curiosity, what is the the traditional Chinese medicine thought on chiropractic care?
Mm.
for children or
For
adults? I'm just
Oh, for
curious.
children specifically? Well, also
Or
controversial.
either. Yeah, either.
I mean, it comes down to who your chiropractor is.
Yeah.
It's the same thing for any acupuncture, any doctor out there.
Yeah.
You have ones that are probably better than others. You have ones that probably vibe with you better. Everyone
Yeah.
has different, um, they have different wants, right? When they find a
Yeah.
practitioner. Um, Chiropractic care and acupuncture is interesting where, again, it's two different modes, right? Chiropractor, for example, when we think about adults and neck adjustments, it's a jolt to the immune system and the nervous system, which isn't necessarily a bad thing. And maybe someone needs it at the moment, but Chinese medicine isn't about that quick jolt again, or the quick fix. It's
Mm,
again, the slow trusting process and getting to the root. So, it's not necessarily a bad thing. There's amazing chiropractors out there that I love myself,
yeah.
that, patients get huge results from too. But again, you just have to find the right one for you.
Yeah. I'm mostly asking because for some reason where I am, most of the acupuncturists that I know of also happen to be chiropractors. And I was never sure of what that connection was.
So I do want to preface, chiropractors in a lot of states can take a 3-day course to get to be licensed to be an acupuncturist or use acupuncture needles. They're not technically acupuncturists. So a lot of the time they have the ability to dry a needle, essentially when they get a needle and put it into a muscle and move around. Not to say that's not effective. We sometimes do that too, but they don't learn the energetic system. They're not learning the body holistically. And so that's when I would be cautious about if a chiropractor is saying I'm an acupuncturist without actually going to school for acupuncture and Chinese medicine. It's a whole
Wow.
nother thing and we battle it constantly, where insurance covers chiropractor and chiropractors doing acupuncture where they're just literally putting a needle in a muscle, but they actually don't go to school as long as we do, right? So they don't understand the energetic mechanics of it. They don't understand herbs. So I would go to a chiropractor to get chiropractor unless they're actually acupuncturists and went to school for it. I would go find another acupuncture. And I sit pretty strongly with that.
Wow, that is really, really interesting.
Mhm.
Why can chiropractors do that? Why can they take a 3-day, like what is there's just not regulations?
I think at the end of the day, it's lobbying. They have more chiropractors. They probably lobbied for it. Money.
Wow, that is fascinating. Oh my gosh. I'm glad I asked.
Mhm.
Okay. Can you tell us where people can find your work, where they can find you on social media, where they can find your resources, or maybe even work with you? And again, we'll link everything in the episode
Yes.
notes.
So you can find a lot of education tips on Dr. Felice Chan on my Instagram. I also have a website, drfelicechan.com, that lists everything from my clinic practice. I have an online course that I released earlier this month. It's a 5-hour Chinese medicine course that teaches you everything that I essentially talked about, from finding balance, herbs as medicine, food as medicine, movement, acupressure. I teach you how to read your tongue. So I'll link that as well.
Yes, please do.
Be more intuitive with your body, and because at the end of the day, if you know the right tools to help your body, you can shift yourself.
Yes.
And then you can also find me on moonbowskin.com. It's which we didn't dive into, which is totally okay.
Oh, no, we need to go back. We need to circle back to the skin. No, let's circle back. I
Yeah.
want to talk about
um so
chrysanthemums, right?
Yes, yes. So
Okay.
I'm also the founder of Moonbow, which is a Chinese medicine skincare line. And I started that with my twin sister for the whole purpose of sharing Chinese medicine with the world, because a lot of the time Chinese medicine can feel unapproachable. So skin is the biggest organ in the body. Skin is a manifestation of what happens inside your body. So if your body's feeling off balance, your skin will shift, whether it's dry, whether it's acne, whether you have dermatitis, whether you have inflammation, right? And so Moonbow, I created it for the whole purpose of sharing Chinese medicine in a digestible way. And so we bring a lot of Chinese medicine herbs in our skincare. For example, wild chrysanthemum, which is our hero ingredient, because it's something that I used when I was younger. We used to drink the tea, but also put it on our skin. Whenever we had eye styes and we make chrysanthemum tea and dipped a washcloth or put the tea bag on our eye, your eye styes dissipate in a day, like 3 times, because it's antibacterial, anti-inflammatory. You can put some chrysanthemum on dermatitis or acne or something that's red and aggravated, and it calms it down. And
Wow.
so we pull in 5 to 8 herbs in all of our products. We have 3 main skincare products. We have the cleanser and serum and moisturizer, which we love to use in a 3-step routine for any inflammation on the skin. Whether, a lot of the times postpartum, a lot of women suffer from any type of dermatitis or eczema. And Moonbow is awesome because it cools the system and basically heals it holistically and calms reactive skin. And so, if you're a skincare fanatic and love skincare, it's one of the best. I use it every single day. I had acne issues, 4 or 5 years ago when I was going through a few of my health issues. And that's when we created Moonbow, and it's transformed my skin and my life.
I'm gonna order the moisturizer literally. Well, I'm gonna order all of it today, but I literally have on my to-do list to order a new moisturizer, and it will be Moonbow. So that's really exciting.
Oh my gosh, that
But
means
I
what? You
also
love it.
that feels really important too for even, I mean, the rise in eczema in children. I
Yes.
mean, that feels
Yes.
even relative there. Like that, is that something you would recommend for any age to try on any skin condition, or are there things that you're like, ooh,
So Moonbow is facial skincare, right? So it's great. It's okay for
gotcha.
teenagers, safe for teenagers, and a lot for adults.
Okay.
Sometimes a lot of women, moms have asked whether they can put it on, their children's arm, and for the most part, the
Yeah.
moisturizer is very, very safe for that.
Okay.
Um, yeah, I mean, compared to any pharmaceuticals, everything is pregnancy safe. It's clean. We use a
That's
lot of herbal
amazing.
ingredients. Yeah, we spend a lot of time trying to figure out all the right ingredients.
Wow. That sounds incredible. I'm so excited to give it a try.
You're going to
Well,
love.
okay. Is there anything else skin wise that we need to know? Because I feel like a lot of us have skin stuff or are looking or entering the phase of our life where the skin stuff matters very
Yeah,
much to
I
us.
can share three tips for healthy skin, right? And when we think about healthy skin, you think about, that glow, little wrinkles, and less reactivity, right? And so number one is stress. I'm sure it's like overplayed and people are like, oh, you have to manage your stress, but find the tools to manage your stress. Is it going out for a walk in the sunshine? Is it breath work? And breath work is something so powerful that we as Chinese medicine doctors really emphasize. And it can be even just box breathing or slow breathing, like 5 counts in and out, but breathing into your belly because that activates your diaphragm, your vagus nerve. It helps switch your nervous system. It's so powerful. Is it drinking a hot cup of tea? I think, I really encourage people, whether it's skin issues, any health issues, is try to figure out how you de-stress, because that's the biggest tool to truly healing your body.
Oh my gosh, that's amazing. I'm so excited to try it. Okay. Thank you so much again. And we will, for everyone that's interested, we'll have everything linked in the episode notes that we talked about. You'll be able to find it. You'll be able to find Dr. Felice. And thank you again. And we will see you guys next time on another episode of More Than Milestones.
Thank you so much, Casey. This was so fun.